people. This is a special mom, and today I want to talk to parents or caregivers who have children with special needs under the category of cerebral palsy. Usually, the cerebral palsy is the main cause of everything. It starts with cerebral palsy because we have different categories of special children. We have like visual impairment, we have hearing impairment, we have physically handicapped, we have physically handicapped, we have cerebral palsy, and all those categories. Okay, so usually the nature of all these things start as a result of cerebral palsy, and cerebral palsy is the damage of the brain or the abnormal functioning of the brain. Okay, now today I want to talk about the sensory input or sensory stimming. First of all, let's start with what sensory stimming is. Sensory stimming refers to the behavior of an individual with a neurodivergent disorder. They behave in a way that is not normal sometimes. Actually, this is to make them feel comfortable or just feel good. Okay? In another way that a layman can understand is that a neurodivergent person is an individual that has different or many neurons in the brain. Okay, and sometimes they have the urge to do something, and when they want to do something, the neurons are working all of them at the same time, and that brings agitation to this individual or to the child. Now, stimming is the repetition of a behavior that a child does when the neurons are when the activities in the brain are doing more than they should do, or when the neurons are taking place or something is just happening in the brain. So when all this is happening in the brain, it makes that child want to do certain things. Okay, some of the characteristics that you're going to see in these children is, one, you will notice that they scream a lot. They scream and make a lot of noise that it even irritates the environment. It irritates people that are around, okay? And sometimes you can notice that they are moving in spinning direction. The other characteristics is also that they stare a light. When a light is on, they will sit somewhere or go near a light and just stare at the light. Okay, there is a reason they are doing that, and they are doing that because of stimming. And I said stimming is the repetition of a behavior. Okay, now we have different types of stimming. Okay, and stimming, I say that stimming comes as a result of different or many activities that are happening at the same time that makes this particular child not to function as normal. And that is why you will hear some children are screaming, some are jumping, some are running, some become violent and try to fight. Okay, and I will also teach you or tell you some of the things that you're supposed to do during this time that the child is doing these things, the things that you're going to do to nerve them down or just to cool them down. Okay, so we have different types of stimming. Okay, or sensory stimming. Okay, one of them is tactile stimming. Tactile stimming is represented by touch. You will find some children are rubbing maybe their hair. They'll be just rubbing their hair like this, or maybe if it is a soft silkish bed sheet or stuff, they'll be holding it like this or just doing this. They'll be doing this a lot of the time. That is steaming, and when they're doing that, they're trying to release a lot of energy that is actually in them. Okay, some of them you will find them spinning in one direction, or rather they are repeating one word all the time. It could be a familiar word, or it could just be something that, so long as they scream or say something, they could be repeating that word to those that are trying to develop speech or language. Okay, and then we have what we call visual sensory stimming. Visual sensory stimming is whereby now you will find your child really looking at the lights. They're busy staring at the lights. And even when you switch on that light, they will try and move to the next room where there is light on. They will actually sit there and continue staring the light. Some of them, as they stare the light or the light are too bright, okay? Even when the lights are too bright, you put your child in a place where there is the lights are too bright. It's actually interfering with them because they're feeling some sense of pain. Remember, these are neurodivergent children. They don't function the way a normal person would function due to the numerous neurons they have in their brain. They're not going to function that way. And when you expose them to too much light, that is called, they get overstimulated. And when they are overstimulated, they tend to scream a lot. They scream and make noise, and some even cry, fight, or they can come and hold you tight. They are trying to communicate that something is not wrong. Ensure that when you see these activities, you dim the light or just switch off that particular light, okay? That is overstimulation when it comes to visual sensory stimulus, okay? And then you will find understimulation. Understimulation now, this kind of children, they're going to be affected when the light is dim. Okay, when the light is dim, they are understimulated. This one also affects them. They either become so clumsy, okay, or they are not comfortable. They scream, they squeeze. They can come near you and just squeeze you, or they can even develop a habit of just pinching people around. Okay, so when you notice that, also this kind of children need a lot of overstimulation, a lot of light, bright light, so that the understimulation may not affect them. Because when they're also under stimulation, the body is trying to communicate to them, and in the presence they are feeling a lot of pain. Okay, so when you notice these two things when it comes to visual sensory stimulation, try and adjust according to how your child is behaving. If you're not able to tell these things, then kindly visit a doctor, or a professional will actually explain to you. He'll ask you questions and you will get to know what you're supposed to do at a particular time. Another one is we have vestibular stimming. Vestibular stimming is actually, you find these particular children, they want to bite people. They have habits of biting, they have habits of chewing, they have habits of they just want to chew all the time. Okay, and also the jumping, they jump a lot. Okay, and there are ways we can also control these things. That means, again, as I said earlier, that the sensory overload is happening to them. The neurons are too much, and all of them are performing same activities at the same time. It cannot work. Imagine a machine. You have a machine, and that machine is performing different activities at the same time. At some point, the machine is either going to stop working or it's going to hang. That is the same thing that happens to these children. So when they're having those stimming moments, let us try and find moments where we can help them. Okay, and we also have things like proprioceptive stimming. Okay, I'll talk about it later. So if you want to get to know more information about stimming, how you can help your children navigate through this, kindly join my YouTube channel, Mercy Otieno, and get more insights on this. Okay, so that is what I actually wanted to take. There are so many types of stimming. So in my YouTube channel, I'm going to talk about ways that we can manage sensory stimming. There are ways that we can manage this sensory stimming and live a normal life, so that when the child is overloaded with sensory activities, we will actually know what to do. So if you are a caregiver, parent with special needs children, or you just want to learn more about this thing, hit my YouTube channel and subscribe. Remember, subscribing is free of charge, and click the bell button so that anytime I upload a video, you are able to watch and get insights. It's also about learning. It's interesting to learn about human activities, what happens to them. Who knows? You could also help another. If I help you with this information, you could also help one. So bye, enjoy your time, and